Dr. Johnston, it's absolutely a pleasure to having you here with us in Costa Rica, as an invited guest, and also to kind of explore what we're doing at the aging front. And one of the most important things that we have as a concept behind what we do at the Regenerative Medicine Institute is to look at human beings who are really aging faster than they should. We call it an accelerated aging disorder. And in general, we're aging much quicker than we should based on our genetics and our human potential to stay healthier longer. And one of the things we've been looking at is, or really questioning, is what happens when the astronauts you've been treating for years, 25 years I understand, go into space. What is the impact of what happens in space have to do with how they age?
Well, Dr. Giampapa, first of all, it's really been an educational experience and a real honor and privilege to be here. And to meet your staff and to meet, you brought an incredible group together, and thank you. And to answer your questions, yes, I mean, a lot of our patients who don't take care of themselves are in an accelerated state of aging. And it's our job as physicians to educate them and try to reverse that. And with our astronauts, we take very, very healthy people and we put them in a very hazardous environment. And it is an accelerated state of aging. When you're floating in space 200 to 300 miles out, you're going to get 10 times the radiation. And because you're floating, you get 10 times the bone loss, 10 times the osteoporosis. And you're also getting 10 times the carbon dioxide, just like we worry about global warming and carbon dioxide. I mean, if you close the door to this room and shut off the ventilation, the carbon dioxide increases, and your personality changes, your mental function deteriorates. And so it's all those factors, and because of all those things, you don't sleep as well. You've got to go do spacewalks. You've got to go build a space station, which is what I've spent my career doing. When I first started in 1991 at NASA, was to build the International Space Station, which we've done. And now I've retired, and now I'm working with a private company that wants to build a commercial space station. And so we're trying to use all the things that we've learned over these last 30 years in taking care of our astronauts and making sure that if we find coronary disease at an early age, because we screen for it, we can stop it and regress it, which we have shown in our astronauts. And the therapies we've used and the testing we've used, now what I've learned here last week is we can go another quantum leap in our simple blood and urinalysis evaluations of these individuals. And then we can also take our knowledge of stem cells, and I mean, you know this much more than I do, so maybe explain I need you to explain what I've learned, because I can't do it as well as you can.
So, as we age here on Earth, our stem cells suffer damage at the genetic level, at the cellular level. But what we've now started to see with some of the recent publications in both animal studies and humans, that in space our stem cells also suffer tremendous damage, and perhaps, and I believe you can collaborate this or corroborate this, is that it happens even at a greater rate.
It does. It does. And we've seen that in animal studies and in human studies. We had the Kelly brothers, Scott and Mark, and that was published in Nature.
Because here at RMI, what we do for our personal clients is we collect and store all three of their stem cell types, so that in essence those cells are now in a state of deep freeze where they're not aging, but our clients' bodies are aging.
So it's not just the mesenchymal.
Exactly. The secret to all of this is to mimic what nature normally does in humans as we age, but also as when we were in our height of youth. You have to collect all three stem cell types. That is, the stem cells involved in our immune system, our blood vessel growth and maintenance, and the regenerative potential of the stem cells. And by collecting and storing these cells with a special technique that allows us to collect and store just the healthiest of those cells, we've created basically a bioinsurance program or a banking process where once people hit a certain age, say their mid-50s, when their normal amounts and function of those cells decrease, we can begin to give them back to maintain a more healthy level.
Yeah, that's the fascinating thing that I've learned here. That's the next quantum leap. It's not just performance,
Right.
but it's quality of life and longevity.
Yeah, I think you've hit it right on the head here. And this is about helping to people. Maybe we're not looking to make people live to be 200 or 300 years old. We want people to literally not be in an accelerated aging state, but to be in a more optimal aging state, perhaps age slower than their biological age actually is. And talking about that, then these new testing procedures we have, which look at the aging process at the genetic level and actually at the gene expression level, really give us an idea on how quickly you're aging in general, but also where you're aging quicker. And there's specific genes that are directly involved in maintaining prolonged health. And those genes we can monitor and actually through therapeutic measures actually turn back off the genes that accelerate aging or slow them down at least, and turn back on and enhance the genes that are involved in extended health span.